Order. I now call the Secretary of State, Matt Hancock, to make a statement. Secretary of State.
Thank you very much, Mr. Speaker. With permission, I'd like to make a statement on coronavirus. Since January last year, and especially since December the 8th, when the world's first clinically authorised coronavirus vaccine was given in Coventry Hospital, we've been engaged, all of us, in a race between the virus and the vaccine. As a nation, we've taken some huge strides forward, and we can make careful further progress today, and we must remain vigilant. I can report to the House that there are now fewer than 1,000 people in hospital in the United Kingdom with coronavirus, and the average number of daily deaths is now 9. This progress means we're able to take step 3 in our roadmap today, carefully easing some of the restrictions that we've all endured. People have missed the things that make life worth living, businesses have endured hardship, and everybody has made sacrifices. And while we can take this step today, we must be humble in the face of this virus. We've all learned over the past year that in a pandemic, we must look not just at where we are today, but where the evidence shows we may be in weeks and months down the track. The vaccination programme can give us confidence, but we must be alert to new variants that could jeopardise the advances that we've made. Today, Mr. Speaker, I'd like to update the House on the work we're doing to tackle variants of concern. In particular, variant B1617.2, which is the variant of concern first identified in India, so that we can protect the progress that we've worked so hard to achieve. There's now 2,323 confirmed cases of B1617.2 in the UK. 483 of these cases have been seen in Bolton and Blackburn with Darwin, where it's now the dominant strain. Cases there have doubled in the last week and are rising in all age groups. In Blackburn, hospitalisations are stable, with 8 people currently in hospital with COVID. And in Bolton, 19 people are now in hospital with coronavirus, the majority of whom are eligible for a vaccine but haven't yet had a vaccine. This shows the new variant is not tending to penetrate into older vaccinated groups, and it underlines again the importance of getting the jab, especially but not only amongst the vulnerable age groups. Madam Deputy Speaker, Mr. Deputy Speaker, Mr. Deputy Speaker, in Bolton and Blackburn, we've taken the approach that worked in South London against the South African variant. We've surged in our rapid response team, 100 people so far, who this weekend visited around 35,000 people to distribute and collect tests. We've installed 6 new testing units, we've brought in over 50 new vaccinators and set up 2 new vaccination centres, as well as extending opening hours and capacity at our existing sites. In Bolton, we've quadrupled the rate of vaccination. We carried out 6,200 vaccinations over this weekend, and it's brilliant to see so many people from the most vulnerable groups coming forward to get the protection, whether it's coming forward to get the first jab or coming forward to get their second jab. All in all, this is the biggest surge of resources into any specific local area we've seen during the pandemic so far. It's been coordinated by Dr. Jenny Harries, the Chief Executive of the new UK Health Security Agency, drawing on all the health capabilities locally and nationally that we've built in the last year. I want to thank everyone who's working so hard to make it happen, including everyone at the 2 local authorities, the rapid response team, all the volunteers, including from St John's Ambulance, and most importantly, the people of Bolton and Blackburn for the community spirit they're showing. It's been really heartening, I'm sure the whole House will agree, to see the videos that have been published over the weekend of people queuing up to get the jab. And to anyone who feels hesitant, not just in Bolton or Blackburn, but to anyone who feels hesitant about getting the vaccine right across the country, just look at what's happening in Bolton Hospital, where the majority of people in hospital with coronavirus were eligible for the jab but have chosen not yet to have the jab and have ended up in hospital, some of them in intensive care. Vaccines save lives, Mr. Deputy Speaker. They protect you, they protect your loved ones, and they will help us all get out of this pandemic. Mr. Deputy Speaker, this isn't just about Bolton and Blackburn. There are now 86 local authorities where there are 5 or more confirmed cases. The next biggest case of concern is Bedford, where we are surging testing. And I would urge everybody in Bedford to exercise caution and engage in testing where it is available. Mr. Speaker, Deputy Speaker, I also want to tell the House the latest scientific assessment of this variant. The early evidence suggests that B1617.2 is more transmissible than the previously dominant B1117 variant. We do not yet know to what extent it's more transmissible. And while we also don't have the complete picture on the impact of the vaccine, the early laboratory data from Oxford University corroborates the provisional evidence from Bolton Hospital and the initial observational data from India that vaccines are effective against this variant. This, of course, is reassuring, but the higher transmission poses a real risk. All this supports our overriding strategy, which is gradually and cautiously to replace the restrictions on freedom with the protections from the vaccines. The data suggests that the vaccine has already saved over 12,000 lives and prevented over 33,000 people from being hospitalised. And we're protecting people at a very rapid pace. Last week was the biggest week of vaccinations since the end of March. 36 million people have now had a first dose, and yesterday we reached the milestone of 20 million people having had their second dose across the UK. And I'm delighted to see the figures released by YouGov today, which show that the UK has the highest vaccination enthusiasm in the world, with 90% of people saying that they have had or will have the jab. This was no accident. We began planning the campaign for vaccine uptake a year ago, and I want to thank the huge range of people involved in promoting the benefits of vaccination, from Her Majesty the Queen to Sir Elton John and Harry Redknapp and Sir Lenny Henry, Holly Willoughby and Lydia West, and many, many others. Our campaign has been based on positivity and science, and I'm grateful to everyone, including so many members of this House from all sides who have played their part. From tomorrow, I can confirm that we will be inviting people aged 37 to come forward before expanding this further later in the week. It's been brilliant to see the enthusiasm people have had when they've been invited to come forward. And we want to make it as easy as possible for people to show that they've had the protection that the vaccine provides. And I'm delighted to say that as of today, people can now demonstrate whether they've had their jab quickly and simply through the NHS app. Mr. Deputy Speaker, since January, we've been following a dosing interval of 12 weeks for second doses. Because the extra protection you get from a second dose, particularly amongst those most likely to end up in hospital or dying, it is incredibly important that everyone comes forward for that second dose at the right moment. The approach we've taken aims to give the most vulnerable the strongest possible protection against the virus. So since January, that's meant getting the first dose to as many people as possible, as quickly as possible. The research shows that this approach has saved around 12,000 lives. Now it's important to accelerate the second doses of all those most vulnerable to ending up in hospital or dying. So our vaccination strategy for all parts of the UK, including the areas of surge vaccination, will stick by the clinical advice set out by the JCVI. First, prioritise anyone over 50 who has not yet been vaccinated. Next, second doses to those over 50 are vital, which will now be done at a schedule of 8 weeks. Then follow the cohorts in priority order and the age groups as we open them. This clinically approved approach is the best way to save the most lives, rather than jumping ahead with first doses for younger people. While the JCVI, of course, keeps this clinical advice under constant review, we are clear that their advice is the best way to protect those most in need of protection and so save as many lives as we can. The NHS will be reiterating this advice to all vaccination centres and all directors of public health, and I'm very, very grateful to everyone in the NHS, in local authorities, and in the whole system supporting this vaccination programme for following it. Mr. Deputy Speaker, today's opening and step 3 marks an important step on our road to recovery. We must proceed with caution and care and bear down on the virus in whatever form it attacks us, so that in this race between the vaccine and the virus, it's our humanity, our science and our ingenuity that will prevail, and I commend this statement to the House.
Jonathan Ashworth.
Thank you, Mr Deputy Speaker, and I thank, of course, the Secretary of State for advance sight of his statement. And may I just at the start, Mr Deputy Speaker, congratulate Leicester City football team on winning the FA Cup on Saturday. The winning goal from Tielemans was one of dreams, and Leicester City fans boast that foxes never give up. And nor do I, Mr Deputy Speaker. So, turning today to the matters before us. Yesterday, he warned on the television that the B1617.2 variant could spread like wildfire amongst the unvaccinated. But does he accept we could have avoided this? Our borders have been about as secure as a sieve. The delay in adding India to the red list surely now stands as a catastrophic misstep. Now, 1 month ago in this House, I urged him to act quickly in response to this variant. The Sanger Institute data shows rapid increase in this variant, 30% of all sequenced cases in the UK, and that excludes cases from travel and surge testing. Alarm bells should be ringing, because while he offers reassurance that vaccines are effective, we've also heard from Professor Anthony Harden of the JCVI recently, who has warned us that vaccines are almost certainly less effective at reducing transmission of this variant. Now, I entirely appreciate that when questioned, I suspect he won't be able to give a cast-iron assurance about opening up on June 21st. And I'm not going to try and push him into a corner. We all understand that we're dealing with uncertainties. We've got to be grown up about these things. But we do need a plan now to contain this variant urgently. He's said to be considering local lockdowns. Well, I speak, as he knows, as a resident of long lockdown Leicester. So before he takes out his mallet to try to whack moles again, can I suggest a number of things he tries first? Firstly, can he consider surge vaccination in all hotspot areas and go hell for leather to roll out vaccination to everyone? I was listening carefully to what he said about vaccination increases in Bolton, and I hope that also includes Blackburn. Is he saying that everyone over 18 in those areas will now be eligible for vaccination? As he knows, that's something the public health directors on the ground have been calling for. I hope we can listen to him. But he knows, because we've had these debates before in the House, that even if we drive up vaccination to as high as it possibly can go amongst adults, there are still around 20% of the wider population, i.e. children, who remain unvaccinated, which means the virus can still spread. The CDC in the US is moving to vaccinate children, so can he update us on what progress he is making on that front here? And with respect to children, can he also just clarify to the House that he will know today that in many secondary schools mask wearing is no longer necessary? Can he just assure us that he thinks that is the right response in light of the data that he's been unveiling today? Secondly, he's announced extra surge testing, but he knows by now that surge testing must be backed up by proper sick pay and decent isolation support. That should have been fixed in the Queen's speech last week. Thirdly, more venues are opening up today, and in many of those venues they'll be spending a lot of time disinfecting surfaces like we do in here, for example, which is good and important. But we know so much more about this virus now. We know about airborne spread of the virus. So why aren't we supporting venues more with ventilation? What are we doing in supermarkets, shopping centres, larger venues where air circulates around the building? What are we doing to help them put in place COVID-secure air filtration systems? Fourthly, what he said about the NHS and the uptake of beds is welcome. But NHS staff, as he knows, are exhausted and they will be fearing another surge. So can he tell us what modelling has been shared with NHS leaders and what they are doing to prepare for any surge in admissions? And finally, Mr Deputy Speaker, the surge in this variant reminds us that we are not safe until everyone is safe. That is not a slogan, it's a fact. 3.3 million lives have been lost globally to this virus, and Dr Tedros from the WHO warns that we're on track for the second year of this pandemic to be far more deadly than the first. Only 0.3% of vaccine supply is going to low-income countries. Trickle-down vaccination is not an effective strategy for fighting this deadly virus. Not only do we have a moral responsibility to play our part internationally, it also reduces the risk of new variants bouncing back at us and setting us back. So at this critical time, when we need to work internationally to defeat this virus, why are we the only G7 nation cutting our aid budgets? How can he defend cutting our contribution to vital science and research projects? And given the total silence from the government on President Biden's support for the temporary lifting of patent protections to increase vaccine production, should we assume that this government does not agree with President Biden?
Secretary of State.
Right, thank you very much, Mr. Speaker. If I address the substantive questions that he asked, the first question was about the surging of both vaccines and testing into these hotspots. And we've seen in South London earlier in the month and last month that this sort of surge testing can work. We had an outbreak of the South African variant in South London. We put in over 200,000 tests, and we effectively managed to contain that outbreak. That is the approach that we're taking in Bolton and in Blackburn, and we will also take that approach if we see a further spread in other areas of the country. It's something that we have been working very hard on to ensure that we have that capacity and that we can do that effectively. And we do that, of course, hand in glove with the local authorities in question who know the communities on the ground. We're also making sure that we have the vaccines available. But I want to be absolutely crystal clear about the approach to vaccination, because he asked about vaccinating all over 18s in Bolton and in Blackburn. That is not our approach. I have looked into it in great detail and we have taken clinical advice. The approach is to make sure we get as many second vaccinations done as possible, as many first vaccinations amongst the vulnerable groups, and then as many vaccinations as possible for those eligible groups who are under the age of 50. And the reason that we've taken this approach is because that is what is most likely to save most lives. That second jab is absolutely vital. And of course, the first jab for anybody over 50 could be the difference between life and death. And so the very strong focus is to get the vaccine into to all those over 50s who have not yet taken the first jab. And I'm glad to say that there are reports from both Bolton and Blackburn that uptake amongst people who are eligible but haven't yet got the jab has increased since we saw the rise of the B1617.2 variant in those areas. I think because it's effective in proving to people that the jab really does work to protect you. That is what the data shows. He asked about children. I've been closely following the results of the clinical studies from Pfizer that show that the vaccine is safe and effective amongst children between the ages of 12 and 18. We have procured enough Pfizer to be able to use the Pfizer jab and offer it to children, should that be clinically approved here. But given that we're at the stage of opening tomorrow to people aged 37, there's some time to go until we'll reach to 18-year-olds. We're on track to meet the target of offering the vaccine to all those age 18 above by the end of July. So we have a couple of months before we need to make and operationalise a decision, and we want to be very, very careful and sensitive around whether and how to offer the vaccine to children. He asked about wider measures which are important. Ventilation, he mentioned, and we have put in place guidance for businesses in terms of strengthening the rules around ventilation, and that too is important. He did a bit of a Captain Hindsight act, I thought, when it came to the Indian variant. He didn't seem to mention that we put India on the red list before this variant was deemed a variant even under investigation, let alone a variant of concern. And indeed, we stopped we put India on the red list before other countries like Germany and Canada stopped flights from India. We have a strong policy of restrictions at the border, and we will remain vigilant. The final thing I wanted to respond to was his point about the global moral responsibility to vaccinate everybody in the world. He's absolutely right that we have a global moral responsibility, and I would argue that the United Kingdom has done thus far and will do more than any other nation. It's not just about the huge sums that we've put into COVAX, but it's about the way that we've delivered the Oxford-AstraZeneca vaccine around the world. As of this morning, there were 1.47 billion vaccines that have been delivered globally. 400 million of those have been the Oxford-AstraZeneca vaccine, and AstraZeneca has charged a profit margin and a margin for intellectual property of 0. No charge for intellectual property, no profit for AstraZeneca. Costs, of course, need to be met, but we have taken nothing for the money that we've put in to the development of this. This is the biggest gift that this country could give to the world. 65% of those 400 million doses have been delivered into arms of people in low and middle income countries, including over 150 million in India. Of the COVAX facility, which is the biggest global effort to vaccinate in low and middle income countries, they have delivered 54 million vaccines so far. 53 million of those have been done with the Oxford-AstraZeneca vaccine. This country can be hugely proud of the contribution we've made. It's far bigger so far than any other country, because we decided, and we took the view from the start, the UK approach, which is you don't need to change your IP rules, you don't need to change the law, we just get on and get this vaccine out to as many people around the world as possible at cost. Everybody in this House should be very, very proud of what AstraZeneca and Oxford University have done with the support of the UK government, and that is how we save lives around the world.
Jeremy Hunt.
Mr Deputy Speaker, many of these new variants come from abroad, so clarity on borders policy is essential. We know that the first wave, now we know, was largely seeded from people coming back from their spring holiday break in Italy, France and Spain. So could I ask him for absolute clarity on the amber list? Should my constituents in Farnham, Godalming and Hazelmere, or all of our constituents, go on holiday to countries on that amber list, even when it is no longer illegal?
Mr. Speaker, the answer is no. The official government advice is very clear that people should not travel to amber or red list countries or territories. People should not travel to amber list countries for a holiday. These lists of what's on the amber list, what's on the red list, and what's on the green list are kept under review based on the data that is assessed by the Joint Biosecurity Centre. Our priority is protecting the progress that we've made at home, and we will assess any new countries that might go onto the green list every 3 weeks, and of course constantly monitor to check that the countries on the green list remain safe. But if it isn't on the green list, then unless you have an exceptional reason, you shouldn't be travelling there.
Video link. Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. COVID cases in India began to soar at the start of April. So why were Pakistan and Bangladesh added to the red list at that time, but not India? Was it because of the Prime Minister's planned trade visit? After finally adding India to the red list on the 19th of April, it didn't take effect until the 23rd. How many people arrived from India in those days trying to escape going into hotel quarantine? When I previously raised the issue of applying hotel quarantine to all travellers, the Secretary of State claimed the current system was protecting the UK. Does he now accept that the entry and community spread of the Indian variant shows this simply isn't the case, and that having a negative test doesn't rule out that travellers are carrying COVID? SAGE has stated that evidence shows the B1617.2 Indian variant is up to 50% more infectious than the Kent variant, and have advised that, as in Scotland, areas with rising cases should remain under COVID restrictions. The Indian variant has been doubling every week despite lockdown. So why is he ignoring sage advice and opening up areas like Bolton that have exponential growth? Thankfully, this variant doesn't show significant vaccine resistance, but he must know it isn't possible to outrun the virus through vaccination alone. With those up to 35 not eligible for surge vaccination, this leaves a large pool of unvaccinated people in whom the variant can spread. And even those who receive a vaccine in the coming weeks, it will take 2 to 3 weeks before they are protected. Does he not accept that this variant is in danger of surging and that without local travel restrictions will spread to other areas? While it's good news that fully vaccinated people aren't ending up in hospital, just letting it spread among young adults could allow the evolution of yet another UK variant.
Secretary of State.
Thank you, Mr. Deputy Speaker. I answered these questions in the response to the honourable gentleman. The truth is that when we put Pakistan on the red list, and indeed Bangladesh, the positivity of those arriving from Pakistan and Bangladesh was 3 times higher than from India. That's why we took those decisions. And of course, that decision was taken before the Indian variant became a variant under investigation, let alone a variant of concern. And it's striking that the Scottish government took a red list decision on India at the same time as we did in the UK government. So it's all very well to ask questions with hindsight, but you have to base decisions and policy on the evidence at the time. When it comes to how we're tackling this in the UK, she's quite right that it is good news, early news, but good news, that the vaccines do appear to be effective against the B1617.2 variant. And I'm obviously pleased about the evidence that we've seen, but we're vigilant about that. And I'm very glad that the approach that we're taking now in Bolton and in Blackburn worked in South London against the South African variant. We keep these things always under review, but I think as a first resort, surge testing, going door to door, making sure we find and seek out this virus wherever we can spot it, putting in the extra resources with the armed services who are supporting, that is the right approach whilst we keep this under review. The numbers thus far nationally are still relatively low, and thankfully we have a very, very good surveillance operation across the UK so that we can spot these things early and take the action that we need.
Greg Clark.
Thank you very much indeed, Mr. Deputy Speaker. Does my right honourable friend agree with Sir Patrick Vallance, who told my committee that new variants will arise all the time and border restrictions will only slow, not prevent, those variants that originate overseas? So what level of vaccination protection do we need to get to in this country before he's in a position to rescind the rather strange advice he's just given to our right honourable friend and allow people who've been tested 3 times and quarantined for 10 days to travel to places like France and Spain?
Typically, from my right honourable friend, he asked the most pertinent question, to which we do not know the answer. Because the level of vaccination that you need to be able to withstand the incursion of new variants, even that the vaccine will work against, does depend on their level of transmissibility, and we don't know the increased level of transmissibility over and above the B117 previous main variant here in the UK, that was the variant that first was discovered, of course, in Kent. And therefore, this is an absolutely critical question, but unfortunately we don't know the answer to it yet.
Munira Wilson.
Thank you very much, Mr. Deputy Speaker. Having reached this tremendous milestone today, and given the sacrifices the British people have made through lockdown and the fantastic successes of the vaccination programme, will the Secretary of State listen to his own colleague, who said last week that with the new variant, we must isolate, isolate, isolate every single case and its contact. So will he finally commit to paying people's wages to stay at home to self-isolate, providing practical support in terms of accommodation if necessary and support for dependents? Otherwise, we will only go backwards.
I'm afraid I don't agree with her characterisation of the situation, not least because the approach we're taking in Bolton did work effectively in South London, where we are piloting new approaches to ensuring that we can support people to isolate, and some of those pilots are taking place in some of the areas where we can see cases of B1617.2. We keep that under close scrutiny and close review to see what works effectively.
David Johnston.
Thank you, Mr. Deputy Speaker. Part of our fight against COVID, or indeed future viruses, is to improve our domestic vaccine manufacturing capability. To that end, the government's fast-tracking the Vaccines Manufacturing and Innovation Centre at Harwell in my constituency. I'll be visiting in a few weeks, but could my right honourable friend provide an update on the progress so far?
We're making significant progress with onshoring of vaccine capability. It's about developing the vaccine, as the team at Oxford did brilliantly, but also they're manufacturing it onshore. And boy, if there's one lesson that we've learned from this whole thing, it's that you can't just not care about where manufacturing happens. Having it onshore really, really matters for resilience, but also to make sure that it's close to the NHS so that we can learn, the whole supply chain can learn and constantly improve. So I'm delighted that we're pushing forward with the VMIC project in the same way that we've brought onshore manufacturing supply in Teesside, in Livingston in Scotland, and of course the fill and finish plants both in Wockart, in Wrexham, and in Barnard Castle and elsewhere. It's a big project, and it's frankly a big opportunity for life sciences in the UK to make sure that we can do all this onshore, because the pandemic, in my view, has shown that we need to.
Revealing. Jim Shannon.
Speaker, can I thank the Secretary of State for his statement and for his comprehensive answers as well. I know that the Secretary of State has regular discussions with the Northern Ireland Assembly Health Minister Robin Swan. There has been a surge in the mutant and Indian variants in Donegal in the Republic of Ireland and the maiden city, Londonderry, in Northern Ireland. So can the Northern Ireland Assembly Health Minister call upon the UK for expertise from Westminster to help assist, which I believe will show once again that we're always better together with the United Kingdom of Great Britain and Northern Ireland. Thank you.
I couldn't agree more with the honourable gentleman. The UK fights this together. There are, of course, outbreaks also in Moray and in Glasgow, and I've been talking to the Scottish Cabinet Secretary for Health about the action that's going on to tackle the outbreaks there. And I talk regularly, very frequently, with Robin Swan, who I think is doing an absolutely brilliant job with the health portfolio in Northern Ireland. But the fundamental point that the benefits of the United Kingdom working together are once more demonstrated by our ability to work together to tackle this variant.
Video link. Dr. Jamie Wallace.
Thank you, Mr. Deputy Speaker. More than 20 million people have now received their second dose of the vaccine, an achievement which demonstrates the phenomenal pace at which we are delivering the vaccine across the UK. Does my right honourable friend agree that this incredible milestone demonstrates what our union can achieve when we work together?
I just waxed lyrical about the value of Scotland and working with the UK government, and of Northern Ireland working with the UK government. My honourable friend almost chastises me for not mentioning Wales. Of course, working with Wales is incredibly important. Look at the fill-finish plant in Wockart. The number of people who have been vaccinated in this country with a product that is manufactured in Wales measures in the tens of millions, including myself. And we should all be very proud of that. And I look forward to working with my new Welsh counterpart, the Health Minister, for Wales, and making sure that we use all capabilities across these islands to get us back onto the road to recovery.
Liz Truss.
Thank you, Mr Deputy Speaker. Today sees the long-anticipated lifting of many of the restrictions on our life and social life. At the same time, this strain of the virus reminds us that we need to be cautious in how we mix and how we hug our loved ones. It's important that we have clear messages about interaction. So will the Secretary of State ensure that government messages are clear and unambiguous and not mixed as at present?
It's really clear that we are removing restrictions. I'm delighted that we're able to remove restrictions. For instance, the absolute restrictions that were in place in terms of close physical contact, and rely more on people's personal responsibility. And in order to do that, of course, we are providing the best possible advice that we can. For instance, to be able to hug, but hug cautiously, everybody knows what that means. It means outside is better than inside. It means make sure it's in ventilated spaces. It means if you've had the vaccine, and particularly 2 vaccines, then you are safer than if you haven't. And I think it's incumbent on all of us to communicate these messages from our scientists, make sure that people understand them. And I'm pretty sure that the British public gets this. And given how brilliantly people have responded to requests during the pandemic, I'm highly confident that this approach will be successful, and people will be cautious but enjoy the new freedoms that we're thankfully able to give.
Mark Harper.
Thank you, Mr Deputy Speaker. I listened very carefully to what the Secretary of State said in his statement about people being able to prove that they've had the vaccination through the NHS app. And I also listened carefully to what he said about the importance of the union. Can I just draw to his attention something that I hope he can look at urgently, which is I've got thousands of constituents who live in England but are registered with GPs that are registered in Wales and receive their vaccinations in Wales. At the moment, it is not proving possible for them to register with the NHS app that they've had their vaccination. Can I ask him to urgently fix that for my constituents and those across our United Kingdom?
This is another example of where we work better together as one United Kingdom. We are working to solve this problem precisely. Coming from the borders with Wales myself, I understand this very clearly, and so the data work is underway to ensure that there's interoperability between the data systems in England, Wales, Scotland and Northern Ireland. When this situation was not foreseen when health responsibilities were devolved, I've been working with my counterparts in the 3 devolved nations on fixing it. We've agreed to fix it, but getting these data to talk to each other is technically complicated, but it is underway.
Video link. Paul Blomfield.
Thank you, Mr Deputy Speaker. In its decisions on easing the lockdown, the government has rightly emphasised the importance of being driven by data. But when Pakistan and Bangladesh were added to the red list, the data showed that daily infection rates were substantially higher in India. So will the Secretary of State admit that the decision not to put India on the red list at that time was influenced by the Prime Minister's imminent visit to Delhi and the desire to secure a trade deal? And does he now recognise that was a mistake?
Mr Speaker, if I could just explain the data to the Honourable Gentleman, I'm sure that he'll understand. The measures in terms of the case rate per 100,000 are of course influenced by the amount of testing that's done in any country. And there isn't nearly as much testing in Pakistan as there is in India, or indeed as much in Bangladesh. So the measure, as I said in my initial response to his honourable friend on the front bench, the measure of the rate of in terms of positivity of people coming from Pakistan was 3 times higher than the rate of positivity of people coming from India, which was at that time quite low. So you've got to be just careful with the raw data here, and you've got to look at the underlying positivity. One of the advantages of having the testing of everybody at the border is we now have effectively a global surveillance system to understand the positivity of travellers from any individual country. And as I said, the decision was taken on the basis of the fact that the positivity was 3 times higher from Pakistan than from India.
Video link. Mark Logan.
Mr. Deputy Speaker, in Bolton, we're battling the Indian variant, currently standing at 274 per 100,000. The heroes of Bolton jabbed 6,200 people this weekend. Well done to the Health Secretary and his department. Can the Health Secretary also pay tribute to the Bolton team, Councillors Greenhalgh, Baines, Morgan, as well as Dr. Lowy and Dr. Wall? And can the government commit to first dosing the whole of Bolton before the end of May and getting that second dose out to more vulnerable groups at a similar pace? And finally, what would the Health Secretary like to stress to Boltonians as we open up today with the rest of the country?
Secretary of State.
Thank you very much. Mr. Deputy Speaker, there's one other person who the Honourable Gentleman didn't add to the list, probably due to modesty, and that's himself. He has worked incredibly hard over this last few days to get the message out to people across Bolton, and I'm very, very grateful. My message to everybody in Bolton and in Blackburn is take these steps, but please take them safely and get a test and get yourself vaccinated as soon as you're in one of the eligible groups. It is incredibly important that we get vaccinations to anybody over 50 who hasn't had a jab yet. Please come forward now. Anybody over 50 who's had 1 jab, if that was 8 weeks ago or more, come forward for your second. And crucially, get a test. I also pay tribute to all those he mentioned. Councillor David Greenall, the leader of Bolton Council, has worked incredibly hard too, and his whole team. We're working cohesively together, and I very much hope that with that effort we can get this sorted.
And the next video link, Matt Weston.
Thank you, Mr. Deputy Speaker. Obviously, vaccines are important, but so is testing. 6 months ago to the day, the Health Secretary told us that the UK would open 2 new mega laboratories in early 2021 to double the country's capacity for carrying out COVID-19 tests. We were then advised it opened in early spring. The one in Scotland was cancelled. The one here in Leamington remains surrounded in secrecy, NDAs and private contracts for staff employed by private companies, some linked to Conservative donors. The Health Secretary will be concerned by the delay, I'm sure, even if he doesn't have a financial concern in this project himself. Can he just tell us what is going on, and can he confirm when the place will open and that staff will actually be employed directly by the NHS?
Thank you very much, Mr. Deputy Speaker. We have a PCR testing capacity in this country of many hundreds of thousands more than we use each day. The Leamington Spa project is incredibly important. People working there are doing a magnificent job, and frankly, I don't think the rest of his question deserves an answer.
James Carledge.
Can I strongly share my right honourable friend's sentiment which he expressed earlier about his pride in the role the United Kingdom has played in the global vaccine effort through the Oxford AstraZeneca vaccine? But of course, the Indian variant has shown us we do remain vulnerable while the virus is rampant abroad. So can you say what further steps we can take in the global fight against COVID?
Yes, Mr. Deputy Speaker, my honourable friend makes an incredibly important point that we cannot stress enough, which is that we all have a role to play, and especially developed countries have a role to play in making sure we get the vaccines around the world. And the UK approach is focused on outcomes, on getting as many people vaccinated globally as possible. And the best way to do that is to allow the work that we've done here, the research and the proving of the Oxford AstraZeneca vaccine, to then be replicated and manufactured everywhere at cost. That is a better approach because it protects the future intellectual property values, and it allows for the research money to go into new vaccines and variant vaccines and doesn't undermine the system of intellectual property, which is the underpinning concept of all pharmaceutical development, yet at the same time it makes sure that we get people vaccinated around the world. And this country should be incredibly proud of the fact that we have helped vaccinate over 400 million people, with many, many hundreds of millions more to come.
Tonia Antoniazzi.
Thank you, Mr Deputy Speaker. On Saturday, my friends and I put on our trainers and walked 26 miles in Goa to raise a bucket load of cash for the fantastic breast cancer charity Walk the Walk. As Chair of the All-Party Parliamentary Group on Cancer, I know only too well the devastating impact the pandemic has had on cancer services. Now, one of the key ways the Secretary of State can help with the government's goals of recovering from the pandemic is ensuring we have enough well-trained and motivated NHS staff now and into the future. Therefore, what discussions has the Secretary of State had with the Treasury to ensure a comprehensive multi-year funding settlement for the NHS in the autumn spending review? With me and Macmillan Cancer Support to discuss this urgent matter.
I'm always very happy to meet with the Honourable Lady, and she works incredibly hard on this topic. I'm delighted to say that the recovery of cancer services is going well, and in many of the centres, the rate of both diagnosis and of testing and of surgery is above 100% of 2019 levels. This is very important. Of course, we're working towards the spending review, and the NHS has a long-term baseline settlement. But on top of that, we're putting extra money into the recovery that she rightly champions. And I'd be delighted to talk more with her about it.
Richard Graham.
Mr. Speaker, the message today is all about the balance of celebrating the return of more freedoms today and in the future with caution, depending on the good sense of my constituents in Gloucester and elsewhere. Can my right honourable friend confirm how many of those recently hospitalised in Bolton from the new variant had already been vaccinated? Tell us what more we can do to help spread the word to those who haven't yet agreed to be vaccinated, and also confirm what he expects the role of pharmacies in testing to be as we go forward.
Thank you very much. The best understanding that we have is that 5 of the 18 who were in hospital yesterday had been vaccinated once, and 1 had been vaccinated twice, but it's not clear how recently. Therefore, the majority had not been vaccinated, and of them, most of them could have been vaccinated, which is frustrating to see, but is also a message to everyone. We monitor this very, very closely, and the latest information on those who've ended up in hospital, gone into hospital, been admitted to hospital in Bolton over the weekend is similar, that the majority are unvaccinated. So it just reinforces the message that people should come forward and get vaccinated, because that's the best way to protect everybody.
Video link. Rachel Maskell.
Thank you, Mr Deputy Speaker. Prior to Christmas, it was the mutation, the Kent variant, mixed with the opening of the economy in York, which caused a rapid spike of COVID-19 infection as people en masse came to visit our city, and spread the virus to the hospitality sector, where today many of the workers have yet to be vaccinated. But here we are again, a different variant, the Indian variant, and who knows what will come next, with high transmissibility about to be spread. In a city where many people are already visiting, more to come, we feel vulnerable. So what proactive preventative steps will he take so we do not pay that heavy price again for the government not acting fast enough?
Thank you very much. The most important difference between now and then is, of course, that the vast majority of those who are vulnerable to ending up in hospital or dying of COVID have now had 2 vaccines. The uptake rates of the vaccination have been absolutely spectacularly high, and the uptake rate of the second vaccine has also been incredibly high. And this means that the protection afforded to those who have chosen to take up the vaccine is very, very high, with the latest estimates that having had 2 jabs and then waited a fortnight or so after your second jab leads to around a 97% reduction in mortality. Now, of course, we will continue to drive and open up access to find those final few percent of people, but the lesson from the last few days is that if you have not yet taken up that opportunity to be vaccinated, then you should, because it's those people who have sadly ended up in hospital, and we don't want to see that.
Will Rack. Thank you, Mr. Deputy Speaker. The Health Secretary can be rightly proud of his role in the vaccination programme. I, of course, welcome the reduction further in age of those eligible, and it may surprise him and indeed the House that despite my appearance and general manner, there are still a few years yet to go. But I will be there seized with the importance of taking up that vaccine. But can I urge him to favour that surge of vaccination rather than even flirt momentarily with the idea of imposing local restrictions, which are neither helpful and indeed bring about a great deal of resentment?
Well, Mr. Speaker, I'm glad to say that we'll get there before the end of July to my honourable friend, no matter how young he is, and because I'm pretty sure he's an adult. In both actuality and attitude, crikey, I'm getting myself into more trouble than I anticipated. But his broader point, which is a call against local lockdowns, is one that I understand, and we've had differences of view on this in the past. It is not where we want to go. Of course, we don't rule it out, but we have seen the approach that we're taking work. We saw it work in South London, and we have this huge testing capacity that we just didn't have in the autumn, of hundreds of thousands of tests a day that are available, which is expanding, as the honourable member for Leamington Spa articulated. And we have these lateral flow tests, which are simple and easy to use, and you get the result fast, and we've got millions of them. So the surge testing plus the vaccine means that we have so many more tools at our armoury than we did before.
Video link. Peter Grant.
Thank you, Mr. Deputy Speaker, and I'm certainly very grateful in advance to the NHS Fife staff who will give me my second dose of the vaccine exactly 10 weeks to the day after my first one. The Secretary of State has indicated that a factor, probably a significant factor in the spread of this highly transmissible new variant has been people who could have been vaccinated by now, but who for whatever reason chose not to accept the vaccine. And there will be genuine concerns that people have in a number of cases, but a major issue has got to be that people are declining the vaccine because they're believing the lies that have been deliberately and maliciously spread by anti-vax campaigners on social media. What further action does the government propose to take against those who are deliberately spreading these lies for no other purpose than to put the lives of others at risk?
Well, the anti-vaxxers haven't had a very good time of it recently, and I'm absolutely delighted take-up is as high as it is. But one of the reasons that we've been able to take on the anti-vaxxers so effectively is because we haven't danced to their tune. Instead, what we've done, and what members in this House right across, and I'm looking around now and I see people on all sides of the House who played their part in this, we've put across the positive, science-based, objective enlightenment values, if you like, of why the vaccine is the right thing. And we, as a House, as leaders of our national debate, have done that with one voice, based on that scientific advice. We've done it across the 4 nations of the United Kingdom with one voice. We've done it with scientists, with clinicians, with religious leaders, with all those who have a strong voice in this debate. And it's telling the positive story that is the vital thing that we can do. Of course, there may be those who do otherwise, but we shouldn't, that isn't for us. For us is to tell the positive story, and I'm very, very grateful to the Honourable Gentleman for himself playing his part in that by celebrating having his second jab, and I'm absolutely thrilled that he'll have that protection in just a couple of weeks' time, the maximum protection that you can get, and together he's helping not only himself and his loved ones, but all of us to get through this.
Video link. Hugh Merriman.
Mr. Deputy Speaker, thank you. I was going to ask the Secretary of State to confirm if, for those vaccinated,
there is effectiveness against the B16172 variant. I was also going to ask him how many deaths in the UK from this strain have been recorded from those vaccinated. But given that he's just effectively turned the amber list into red, can I ask him what the point of me having my passport is anymore? This COVID will always mutate. The vaccine will always have to keep up. We've managed to vaccinate 99% of the mortality risk. When will this government actually take a little bit of risk and allow people to get on with their lives again?
Thanks very much, Mr. Deputy Speaker. The red, amber and green lists are there reflecting the risks that there are in other places around the world. The amber list, of course, means that you need to quarantine at home. The red list means that you need to quarantine in a hotel. The green list means that we think that it is safe to travel. So, of course, he should get his passport out. He can get on a plane to Portugal or one of the other countries. It allows for some careful foreign travel. But my first duty is to protect the lives of people here in the UK. And the best way to do that right now is to make sure we are cautious on international travel to protect the opening up here at home.
Rebecca Long-Bailey.
Thank you, Mr. Deputy Speaker. The Secretary will know that analysis of data published by Public Health England shows that the spike in cases in Bolton so far is mostly confined to school children and young adults who are socially mobile and haven't been vaccinated yet. There are valid concerns, therefore, that as lockdown eases today, this might lead to a subsequent rise in cases within unvaccinated cohorts across Salford, which directly borders Bolton. So can the Secretary confirm today that he will act now to protect people in Salford, curb any spread beyond surge hotspots and accelerate the vaccine rollout programme in Salford, not just for second doses, but for first doses for younger unvaccinated cohorts?
Thank you very much. Yes, we're opening up vaccination to those aged 37 tomorrow. And anybody in Salford who's in one of the eligible groups and hasn't been vaccinated should come forward. And if you have been vaccinated more than 8 weeks ago but haven't yet had your second jab and you're in Salford, then please come forward. We have a very, very good surveillance system now in this country, and we publish all the data from it. So we can all see day by day the cases. We can also see the impact on hospitalisations. And I'm glad to say, thankfully, that link which was almost inexorable in the past from cases through to hospitalisations and deaths, that link is now broken. Now, it isn't completely severed, but the link is much, much weaker because of the protection of the vaccine. So those are the things people can do in Salford, I look forward to working with her to get those messages out to everybody.
Sarah Brickliff.
Thank you, Mr. Deputy Speaker. The Secretary of State will know my constituency of Hyndburn and Hasland and borders Blackburn with Darwin, and I want to thank the Department for listening to colleagues' call for that extra support and resources through additional vaccines and surge testing. On a call this morning, Amanda Doyle, our ICS lead for Lancashire and South Cumbria, told us today one of the main concerns is not a shortage of supply but the vaccine uptake. So will my right honourable friend join me in encouraging our residents across Lancashire to come forward for their jab when eligible and reiterate the importance of this to protect our local communities?
Yes, 100%. In the same way as people across Salford, across Greater Manchester, across Lancashire should come forward to get the jab if you're eligible. And we're going, in some areas, like in parts of Bolton, we're going door to door with the jab. In the wider area, we're saying to people, come forward and get your jab. That is the best protection you can have. And also, twice weekly testing is available to everybody now. So come forward and get your test. The more regularly that you get tested, the more that you can help break the chains of transmission. And then when you get that chance, get the jab.
Emma Lowback.
Thank you very much, Mr. Deputy Speaker. Thanks to the Prime Minister delaying travel restrictions, an estimated 20,000 people arrived in the UK from India before restrictions were put in place. Can the Secretary of State inform the House how many of those arrivals were COVID positive and then subsequently quarantined, and if not, why not?
We publish that data, so I refer to the gov.uk website.
Teresa Villiers.
The vaccination programme is one of the biggest and most successful civilian logistical exercises in our country's history, and I thank the Secretary of State for his role in delivering it. It should open the way for our hospitality businesses to start in due course to operate at full capacity, and for events, festivals and conferences also to start. But there is still a lot of uncertainty about when this will happen. Will he publish a plan so that those two crucial sectors of our economy can reopen? It may take a while, but they need a plan, they need a timetable.
Yes, we are working on a plan for this with my right honourable friend, the Culture Secretary, and of course on the social distancing review that the Prime Minister is leading on, and we're committed to making sure we publish that well in advance of the decision that we'll publish on the 14th of June as to what the data show about the step 4 currently planned for the 21st of June. Of course, on the 21st of June, we have set out 4 parameters for taking that step. The first 3 are currently in good shape. The challenge is the new variant, but it's far too early to be able to say anything about that specifically. We will have to see. We'll look at the data up to the 14th of June and make an announcement on that date.
The Video Link, Margaret Greenwood.
Thank you, Mr. Deputy Speaker. COVID restrictions are easing, but almost 5 million people are waiting to start NHS treatment. So now is not the time for a major reorganisation of the National Health Service. Yet the government plans for the future of the NHS and social care would embed a postcode lottery, allow for the deregulation of NHS professions, and allow the discharge of vulnerable patients from hospital before they've been assessed for continuing healthcare. Public consultation on this has been woefully inadequate. So will the Secretary of State pause the entire process until after all COVID restrictions have been lifted, and then carry out a full public consultation so that patients, NHS staff, care workers and unpaid carers can have their say?
On the contrary, the proposed reforms set out in the White Paper, which have come from the NHS themselves, will help to deal with the backlog. They will help to make sure that the NHS is ready for the rest of the 21st century. They have been welcomed by the Select Committee, and I'm grateful to the report of the Select Committee last week, which welcomed them, asking for further detail on a couple of other areas which we'll work with them on. And I would urge her to speak to her colleagues in the local NHS and ask them whether they think that collaboration is the way forward, whether we should have greater interoperability, whether we should have greater integration on the ground and get rid of a load of the bureaucracy that is currently there in law. And if she isn't persuaded by her local NHS or by me or by the Select Committee, Mr. Deputy Speaker, maybe she should speak to her own front bench who also welcomed the reforms.
Logan.
Thank you, Mr. Deputy Speaker. As of last week, over 82,000 doses of the COVID vaccine have been administered across the High Peak. An amazing achievement, and I want to put on record my thanks again to everyone who's made this possible. Yeah. Can I urge the Health Secretary to focus on doing surge vaccinations and surge testing in those areas with growing numbers of new cases to put us in the best possible position so that we can get rid of any remaining restrictions as soon as it is possible?
Yes, this is our planned approach. I'm glad to say that the number of cases across the High Peak is very, very low now. And I'm also glad to see that the vaccination rates across the whole of Derbyshire are really high. I was in Derbyshire just before the elections, and the rates are high. There's huge enthusiasm behind the project, and I pay tribute to my honourable friend's work in making sure that that's what's happened.
Video Link. Caroline Lucas.
Thank you, Mr. Deputy Speaker. Given that the so-called Indian variant is now a variant of concern and linked to several outbreaks in schools, why has the government just abandoned the requirement to wear face masks in secondary school classrooms? The Secretary of State is fond of claiming that he's following the science, but this flies in the face of scientific advice from SAGE, from public health experts, and from teaching unions. And it begs the question as to why he's getting rid of one of the few mitigation measures in schools, which we know actually works, when we have such a very transmissible variant. No one wants to see face masks in schools for longer than necessary, but neither do they want children to lose out on face-to-face education because of virus outbreaks. Once community rates go up, school rates go up. So why is he needlessly putting education at risk?
Well, she kind of answered a question in the question when she said that everybody wants to see face-to-face education. And the thing is that in a classroom setting, being able to see somebody's face does have a material impact, and therefore we don't want to have face coverings in school settings for longer than they're necessary, but we are prepared to have them in place where they are necessary. There is discretion for local directors of public health where there are significant challenges, and it's something that we discuss, for instance, with the Director of Public Health in Bolton and in Blackburn. That's been part of the discussions over the last few days. But what she's asking for is a blanket approach, including in areas where the number of cases is incredibly low, and the decision that we've taken, on balance, taking into account the education risks and the advice from SAGE and from public health experts, is that, she shakes her head, we listen to these scientists and crucially balance both the public health advice and the impact on education, and therefore we're having a more localised approach without the blanket approach that she recommends.
Ron Butler. Thank you very much, Mr. Deputy Speaker. Today's measures are very welcome in Aylesbury, with local pubs, restaurants, the museum and cinema all eager to welcome back customers. Can my right honourable friend reassure local residents that as business and culture return to normality, so too will our health services, and over time it will become easier once again to have face-to-face appointments with GPs?
Yes, and he'll have seen, no doubt, the letter sent out from Dr. Nikki Kanani, who's the Medical Director for Primary Care in NHS England, reiterating the point that it is important to offer a face-to-face consultation for a patient who really wants a face-to-face consultation, whilst also using technology where that is the most clinically appropriate thing to do. And these decisions should be taken between doctor and patient together. There is no greater supporter than me of the use of technology in healthcare, and I think it improves access no end. People do need to be able to go to the surgery if they so choose and see the right person, the clinically appropriate person, and that's the approach that we're taking, whilst making sure that we can use a system that allows people to access the right services in the right settings as much as is possible.
Cooper.
Thank you, Mr. Deputy Speaker. People will understandably feel angry that all of the progress everyone's worked so hard for, supporting the vaccines following restrictions, is now being slowed or potentially put at risk because the government's border measures have failed to prevent the spread of a new variant. Could he tell me, is it true, as reported, that even by the 7th of April, 5% of people arriving from India had COVID, apparently 50 times higher than the rate here? Can you tell me what had that figure risen to by April the 19th? And how many of the 2,323 already identified new variant cases are people who have travelled directly from India, and how many are people who have caught it through onward transmission that wasn't prevented by the border measures?
As I said, the positivity rate for people travelling from India was relatively low at the start of April, and we published the data of the positivity rates from the managed quarantine service. However, by the end of April, the positivity rate from India had risen. So we, the government, took the precautionary decision, even before this variant was deemed a variant under investigation, to put India on the red list. And we did that before other similar countries like Germany and Canada banned their flights. And so I understand the chair of the Select Committee's enthusiasm for pursuing this line of questioning. But what I would say to her is you have to take decisions based on the evidence. You can't take decisions based on evidence that arrives afterwards, which is what she seems to think that we should have done.
Yeah.
Thank you, Mr. Deputy Speaker. More than 70,000 people in Redcar and Cleveland have now had at least one jab, which is an amazing achievement so far. And it's great to hear that the vaccines seem to be protecting against the Indian variant too. Can he confirm that the Novavax vaccine that's made in Teesside will also be tested against the Indian variant and other variants of concern? And can he update us as to when it will be made available as another great Teesside export?
Teesside is playing its part, and in fact I earlier today met Ben Houchin, the newly re-elected mayor of Teesside, to talk about what more we can do to invest in Teesside, to invest in the NHS in Teesside, to invest in life sciences like vaccine production on Teesside, and he's doing an absolutely fantastic job of taking the voice of Teesside right into the heart of Whitehall, as is my honourable friend, of course. And he's quite right to raise this point about the Novavax vaccine, which is going to be manufactured on Teesside. Of course, we will study its impact against the new variants, but we have a high degree of confidence that the Novavax vaccine has a broad coverage. And in fact, one of its attractions is that it has this broad coverage, not just against the variant that it was precisely designed to deal with, but a wide range of variants too. That is part of the theory of the technology that underpins that particular vaccine. It's a very modern vaccine, it's very exciting, and it's terrific that it's being made on Teesside.
Video link. Devendra Mishra.
Mr. Deputy Speaker, we're not safe until everyone is safe. Following President Biden's announcement that the US government will support an intellectual property waiver to help scale up the volume of safe and effective COVID-19 vaccines globally, can the Secretary of State explain why the British government is still blocking the TRIPS waiver at the World Trade Organization?
Because we've got a better approach, and because our UK approach has led to the vaccination of 400 million people. He should take enormous pride in that. And we're able to do this whilst protecting the intellectual property rights that will lead to the development, for instance, of the new vaccines, the new technologies, the variant vaccines that are going to be necessary in the future. And it's that combination of the protection of intellectual property rights plus the giving away of this vaccine at cost to the developing world, to lower and middle income countries. And I just reiterate the point I made earlier to him, which I hope he will take pride in, which is that of the 54 million vaccines delivered through the COVAX facility, of which we are a major funder, 53 million of those doses are the Oxford AstraZeneca vaccine delivered with no charge for the intellectual property. That's the approach we should be taking. That's what we will do, and I would urge everybody around the world to follow.
I do aim to try and take everybody, so if we can have concise questions and concise answers. Secretary of State. Bob Luckman.
Thank you, Mr. Deputy Speaker. My right honourable friend will be aware that London has a younger cohort and is full of communities from across the world, but many are hesitant because of the activities of pharmaceutical companies in the countries of their origin. Now, will he look at aspects of control that we can make sure that those communities can indeed get the vaccine, but the vaccine that they choose to take, rather than be attempting to force them to take vaccines that they're extremely reluctant to do?
Well, we have had a principle of saying that you come forward for the vaccine and you get the vaccine that is there on the day. But of course, we've nuanced this because of the changes in the clinical advice around the AstraZeneca vaccine. And as we reach into further and further into those who are who need encouragement to come forward, we are willing to look at more and more creative solutions to tackle people's hesitancy. As it happens, I was in Brent Central Mosque last week at the at Eid, and it was absolutely wonderful to see the work that they've done in making sure that people of all faiths and none can come forward. And for many Muslim people, it means that in Brent they can go forward to somewhere they're very comfortable being vaccinated. But it was brilliant, frankly, to see teams working in the mosque to vaccinate people of all backgrounds. The imam was vaccinated by by someone with the support of a member of the Jewish community, with me looking on, all organised by a Hindu administrator. It was modern Britain at its best. They've done thousands of vaccines. They've done great work, and I know it's that sort of approach that he's looking for. And if we can do more on the specifics of which vaccine, I'm very happy to look at that.
I think we just heard the skies opening above us, so I'm grateful we can now eat inside restaurants. Emma Hardy.
Thank you, Mr Deputy Speaker. Hull Royal Infirmary is a tower block, and the geography of the building has resulted in a higher number of COVID transmissions being caught in hospital, despite the excellent work being done by all of the NHS staff. I fear that the COVID cases caught in hospital will only increase with a more transmissible strain of the virus. So will the Secretary of State urgently look at providing Hull Royal Infirmary with the funding it needs to improve its building as we all learn to live with this virus?
Well, as she knows, we are building 48 new hospitals over this decade, and 40 of those have been set out. There's a further 8 slots, so she may want to work with Hull Royal Infirmary to bring forward a proposal. And of course, tackling infection within hospital is an incredibly important part of work, which always has been since the time of Florence Nightingale, but it's even more important right now, and I think will be a higher priority over the years ahead. So I'm always very happy to look at all proposals.
Lydia Link. Kate Griffiths.
Thank you, Mr Deputy Speaker. Today's relaxation of restrictions is so welcome for all those who work in the hospitality industry. Pubs, restaurants, leisure facilities, they're all making huge changes to operations to welcome back customers, whilst also ensuring they keep everyone safe. Does my right honourable friend agree with me that we should support these local businesses, at the same time ensuring we play our part in abiding by the safety measures, in exercising caution as we gradually return to a normal way of life?
Yes, of course. I think that my honourable friend puts it very wisely. And as the Member of Parliament for Burton, which is famous for its beer and its pubs, she no doubt speaks for her whole constituency when she says that she welcomes the measures that we're taking, the steps we're able to take today. And people should take these steps with caution. Outside remains better than inside. It's harder in the rain, Mr Deputy Speaker, but it's still better to be outside if you can. But I think putting more down to personal responsibility is the right approach at this stage, with this low level of virus and with this huge scope of the vaccination project. And I'm very grateful to her for her support in pushing that agenda.
David Linden.
Thank you, Mr Deputy Speaker. The Secretary of State will be aware that in Glasgow we are seeing an increase in the virus due to the so-called Indian variant. That means, therefore, that although everybody in this House is celebrating the return to indoor hospitality, many Glaswegians have not been able to experience that today, which we bitterly regret. But up until 6 o'clock yesterday, there were still flights coming into the UK from India, with 20,000 people arriving in the UK since the India alarm was raised about that variant. Does the Secretary of State really want to turn round and look Glaswegians in the eye and say that that was decisive action that has led to them staying in Tier 3?
Well, the history as he describes it is in fact wrong, because we put India on the red list and therefore required hotel quarantine before this variant was designated as even under investigation, let alone a variant of concern. So yes, we did take that preemptive action. And anybody arriving who's been in India in the last 10 days now must go into a hotel in order to quarantine.
Benton.
Thank you, Mr Deputy Speaker. Although the incredible success of our world-leading vaccination programme has seen the number of people in hospital with COVID reduced substantially, thereby relieving much of the pressure on the NHS, many of my constituents are still waiting longer for non-urgent NHS care. I'm delighted that Blackpool Victoria Hospital is included in the pilot project, looking at innovative ways to deliver services and reduce that backlog. But could my right honourable friend reassure me that they will get all the resources they need to remove the backlog as quickly as they possibly can?
Yes. Blackpool Hospital is a fantastic hospital, and the team there have worked incredibly hard over the past year and a half, especially. And I'm delighted that they're part of this the plan to work out how we can go even faster, not just get to 100% of the levels of activity that there were in the equivalent month of 2019, the baseline, if you like, but to get far higher than that, because we've got to get through this backlog. And the backlog isn't just those who are currently on the waiting list, although too many are waiting more than a year, and the waiting list is too long. There's also people who haven't yet presented, but we know are likely to have a problem. So this is a huge challenge, and I'm very grateful to colleagues in Blackpool who are working so hard, not just to get through the backlog, but to learn how best to get through the backlog so that others can learn from them.
Video link. Dr. Andrew Morrison.
Thank you, Mr. Deputy Speaker. The staggering success of the COVID vaccination programme means that non-COVID viruses may well kill more people this winter, sadly, than coronavirus on current trends. Can I ask my right honourable friend whether he is confident that an effective flu jab will be available to address this year's emergent strains of flu? What will he do to maximise uptake by vulnerable groups of the flu vaccine? What's the latest on a COVID booster dose this autumn? And would the flu jab be given at the same time?
He's quite right to ask all these questions. In fact, I met Simon Stevens and the Vaccine Deployment Minister about this morning because we want to make sure that the flu vaccine programme this winter is a success. We had the biggest flu vaccination programme in history last winter. We are trialling currently the co-administration of flu and COVID vaccines. I do this because you put one in each arm, Mr. Deputy Speaker. It's something we're looking at for the autumn alongside as part of a booster programme for COVID. So there is a lot of work underway in this space, and I would suggest that he meets and discusses this with the Minister for Vaccine Deployment, who is now responsible for both the COVID and the flu programmes in order to better tie them together.
Five effort. Thank you, Mr. Deputy Speaker. I heard what the Secretary of State had to say earlier on about testing rates in Pakistan and Bangladesh. But according to Johns Hopkins University, the daily infection rate in Pakistan back in April was 4,500. In Bangladesh, it was 7,000. In India, it was 100,000. So surely if he was taking a precautionary approach, wouldn't that have suggested that he should have placed India on the red list much sooner?
No, the statistic that's missing from that analysis, which was also missing from his honourable friend's analysis earlier, is the amount of testing that's done in each country. So what you have to do is look at the positivity when a selected appropriate sample is tested. It's not possible to do that in many low and middle income countries, and therefore the best way to do that is to look at the positivity rate of people who are travelling to the UK, because there we test everybody, and that's the most statistically appropriate way to assess the question he was rightly trying to assess, and that showed that positivity rates were 3 times higher in India.
The time limit as well on the Queen's speech debate that follows this statement it'll start at 5 minutes. I'm sure it'll go down thereafter. Tobias Elwood.
Mr. Deputy Speaker, I look forward to welcoming my right honourable friend to visit the vaccination hub in Bournemouth. Today's partial liberation of COVID restrictions will be welcome up and down the country, but not least in Bournemouth, where hospitality and tourism are so important. But the development of yet another mutation, such as the Indian variant, illustrates, until this pandemic is brought under control globally, other more deadly mutations may develop. Would my right honourable friend agree that this is a shared global adversary? Will this be raised at the G7 summit? And when does he think our spare vaccine capacity can start to be directed abroad?
Well, Mr. Deputy Speaker, he's quite right to describe the incredible efforts in Bournemouth, which I know he's played a very direct and personal part in delivering. I look forward very much to visiting as soon as I can get down there. And by the way, I agree with Sir John Bell that Bournemouth is a great place to go on holiday, and I'm sure that he agrees with me about that too. When it comes to global support, of course, as and when we have excess doses, we will look to support countries around the world with those doses. But the number of doses that we can support around the world from our excess purchases is small compared to the spectacular support that we've already given the whole world with the more than 400 million doses of Oxford-AstraZeneca vaccine that have been delivered at cost. The majority of doses of Oxford-AstraZeneca that have been injected in low and middle income countries, and 98% of all COVAX jabs given so far have been that vaccine delivered on the back of British science, supported by the UK government, Oxford University, AstraZeneca, doing this all without taking a profit. And that we should be very proud of.
Deputy Link. Deputy Abrahams.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, the wider the gap between the rich and poor, the bigger the difference in our life expectancy and healthy life expectancy. And this has been laid bare over the last year. The UK's high and unequal COVID death toll has been driven by the rampant poverty and inequality that successive Conservative governments have allowed to go unchecked. In January, the Prime Minister promised to implement Professor Sir Michael Marmot's recommendations to address this and to build back fairer. So what discussions has the Health Secretary had with the Prime Minister on this, and will investigating the UK's structural poverty and inequality be part of the COVID inquiry?
Well, I discussed this issue with the Prime Minister, and the Office of Health Promotion is intended to be able to tackle some of these issues, led clinically by the Chief Medical Officer, and make sure that we can strengthen the public health case around government, because so many policies of departments out with the health department are critical in addressing the question that she raises.
Next video link. Peter Byrne.
Thank you, Mr. Deputy Speaker, and I'd like to thank the Secretary of State for yet again coming to the House and updating us on the COVID situation. And the Prime Minister, the Secretary of State and the whole government must take great credit for the vaccination programme. And the Secretary of State is surely right when he says we can only defeat COVID if we have vaccinations. And we've been tremendously successful at that. And I think we did 800,000 in one day last week. But could it be possible, could the Secretary of State say whether it be possible to increase that vaccination rate even higher so that we can defeat this terrible pandemic even earlier?
I hope so. The rate limiting factor remains supply. We get them out as fast as we get them in. There isn't a stockpile waiting. He's absolutely right about the importance of this. And, you know, trusting this science, this vaccine science, is the way out for all of us. And by offering everybody a vaccine, you know, the Bolton example demonstrates that if it's the unvaccinated who end up in hospital, you know, we need to get that message to everyone. And I'd far rather be getting the vaccines out than having to undertake the sorts of local lockdowns that we had in the autumn. It's a far, far better approach because we've got these capabilities, the vaccines and the mass testings. And that's the approach that we're taking. He's quite right to highlight it, and it's very kind of him to say what he said about me.
Next video link. Andrew Salu.
People are really grateful to GP surgeries for their role in the vaccine rollout, but are very keen to be seen face-to-face by a doctor where that's appropriate and in a timely manner. What is the department doing to make that increasingly possible, please?
Yes, well, he'll no doubt have seen the note that went out went out last week from Dr. Nikki Kanani about ensuring that face-to-face access is available to the appropriate clinician, and that the use of technology should be encouraged, but should be a matter for a discussion between the clinician and the patient. For many people, it's more of an advantage. You know, I personally use telemedicine, and it's much more convenient for me as a healthy and busy 42-year-old. But for some people, it is right to see their clinician face-to-face, and so that letter went out last week, and we obviously constantly keep this under review and monitor carefully.
Thank you, Mr. Deputy Speaker. Last week I met with the Lung Task Force for Health.
who raised the concern about an increased occurrence of lung scarring in long COVID sufferers. What assessment has the Secretary of State made of this impact on potential resources going forward for the health service?
Yes, we are, of course, worried about the impact of long COVID, and the evidence is growing in terms of the different impacts. The clinical advice is that there are a number of different syndromes that are together badged as long COVID, because for some people it has an impact, as he says, on lung scarring. For some people the impact is more neurological, and so we've got to make sure that the services and the response, and indeed the research, is targeted at the different types of long COVID. I'm very happy to arrange a discussion between him and our clinical leaders on long COVID, because this is a very important topic.
Video link. Dr. Luke Evans.
Mr. Deputy Speaker, the Health Secretary may be forgiven as he's one of the biggest and busiest people in the country at the moment, but he may well have missed Tillerman's strike from 30 yards and the VAR decision late on in the game. But 21,000 fans did see it live, and many of them were my constituents and that were there to celebrate Leicester City win the cup. But of course, Wembley holds 90,000 people, and this was a test event. So when will we find out the results of this test event and the outcome for things like the Euros in the future?
We'll find out the results in the next few weeks. Of course, the honourable gentleman on the front bench opposite, maybe he was so cheerful in his opening remarks because he was there, and he saw Leicester triumph, and I watched it and I just thought how brilliant it was to see a live crowd again, it wasn't full, that's true, and no doubt it could have been filled, but it wasn't full because we're taking it carefully. I'm working with my right honourable friend, the Culture Secretary, and the Minister for Sport, who I know found it extremely enjoyable to be able to go to a sports event as the Minister for Sport, which is he's missed. We will assess the data that come out of it. Everybody who went is part of a testing regime. We will look at the results of that, as we'll look at the results of the other pilots like the Brits and the snooker at the Crucible, and then make an assessment going forward.
Ruth Cadbury.
Thank you, Mr. Deputy Speaker. The UK's defences against incoming COVID infections are only as strong as the weakest point. I'm still awaiting a response from the Health Secretary about Hounslow's DPH's concerns about COVID-infected seafarers being transported to Hounslow hotels by the shipping companies, no quarantine, nor prompt notification to local public health teams, and no consistent infection control at the hotels. And also, travellers and staff at Heathrow are raising concerns about weaknesses in the arrivals process there. So when will the Health Secretary convince this House that the UK's COVID defences are fit for purpose?
Thank you very much, Mr. Speaker. I pay tribute to the team who have put together the managed quarantine service, which has run remarkably smoothly for such a complicated operation, and they're always very happy to hear feedback and constantly improve the system. And I work very closely with the Home Secretary and the Transport Secretary on this. There have been remarkably few complaints for a system that has had to be put in place for significant numbers of people now.
Video link. Ollie Mumby-Croft.
Thank you, Mr. Deputy Speaker. Can I thank the Health Secretary for his constant support in ensuring continuous vaccine supplies to the Baths Hall? We have, of course, been following the Prime Minister's announcements closely in Scunthorpe. Could my right honourable friend set out more detail on how the move towards some second doses after 8 weeks will be implemented, especially for those who've already booked their 12-week appointment? Thank you.
So I'm delighted we managed to sort out the wrinkle that we had with the supplies of vaccine to Scunthorpe. It was a really good example of the Honourable Lady speaking up for Scunthorpe, and then the Minister got it fixed, that's how this should work. And I'm very glad we managed to sort that. And if there's any further problems, then please do let me know. Specifically, if you have if you're over 50 and you have a second jab booked 12 weeks after your first, then we're inviting people to rebook their vaccination instead 8 weeks, from 8 weeks after, not before 8 weeks, because the effectiveness of the second jab strengthens for those first 8 weeks. And you can do that on the national booking system or through calling 119. And we're texting those who we have the numbers of to be able to communicate. So there's a whole process in place to get people rebooked wherever that's possible.
Douglas.
Thank you very much, Mr Deputy Speaker. People in Chesterfield will be looking forward to getting back to the football stadium this weekend. I'm not sure if we'll enjoy it quite as much as my honourable friend did this weekend, but nonetheless, it is incredibly important to everyone. And for that reason, they will be worried by the sense of the increase of the Indian variant, understandably. And it is important that we get an understanding about those decisions. And I hear what the Health Secretary had to say about the reasons why he thought it was appropriate for India to be put onto the list later than Pakistan and Bangladesh. There will be those who think that the Prime Minister's impending trip to India will have played a factor. We know there's this inquiry coming down the track. So can the Health Secretary confirm and clarify that there was no discussions in the decision to put India onto the red list later than Pakistan and Bangladesh about the economic consequences, about the Prime Minister's trip or anything like that? It was purely the health considerations that were in play there.
These decisions are based on the evidence, and the Joint Biosecurity Centre puts forward the evidence for red listing. In the first instance, the red list is there to stop new variants, but this variant was not a known variant under investigation. But because of the increase in the overall rates and overall positivity of people coming to this country, first in Pakistan and Bangladesh at the start of April, and then towards the end of April from India, we took the precautionary decision to put them on the red list. That is a matter of fact. I'm happy to state that, and the job now is to make sure that we keep this all under control.
Thanks.
Thank you, Mr Deputy Speaker. The success of the vaccination programme has surpassed expectations in part because of the very effective work that was done in tackling vaccine hesitancy at the start. But it is implicit in my right honourable friend's statement that in Bolton and Blackburn particularly there has been less success with persuading some people. Could I ask him what he considers to be the model of good practice in persuading hard-to-reach groups, where he thinks that's taken place and how he'll be rolling it out in those areas?
Well, I'm incredibly proud that the UK has the highest measured rate of enthusiasm for taking the vaccine in the world. I'm incredibly proud, especially as such a diverse nation as we are, that we've been able to achieve that record by taking this positive attitude, by having people like, from Her Majesty down, setting out the value of being vaccinated. And I pay tribute to the comms team at NHS England and my communications team from across Whitehall, who've taken the lessons of how to get a positive narrative, especially on social media, and make sure that we have fought lies with objective truth. And that's been fantastic. On the ground, there are some really good examples. I mentioned my visit to Brent Central Mosque, to whom I pay tribute. Actually, some brilliant work has happened in Leicester, where for instance, there was a vaccination centre right next to an area heavily populated by those of Somali background, but those of Somali background were not going to the vaccination centre despite the fact it was next door. So we set up a vaccination centre almost next door, but where the doctors and the clinicians are themselves Somalis, and we saw a very sharp rise in the Somali vaccination rate. There's one example that I can immediately add to the elucidation of the answer to this question, but there are legion. And in fact, people from around the world have been coming via Zoom to talk to some of our more innovative vaccination centres, whether it's at the mosque or at the Hindu temple in Neasden that's doing absolutely brilliant work, or in Leicester, and now in Bolton and and Blackburn, where I hope that we can make some really significant progress. And frankly, this country should be proud of how people have pulled together to make this vaccination programme work.
Unbelievably, I am older than Will Ragg, marginally. So I've had my first jab, and the second jab is a week Saturday. Bring it on. Secretary of State, thank you for your statement. Today we will suspend for 2 minutes.